Welcome to the Health Collective, your one-stop channel for all things health-related. Our goal is to make health and wellness accessible, exciting, and easy to understand for everyone. Today we're diving into a topic that might sound a bit unusual, but is gaining significant attention in the medical world. We're talking about fecal matter transplants. Yes, you heard it right. This is a real medical procedure, and it's as intriguing as it sounds. We're going to break it down, demystify it, and tell you everything you need to know about it. From what it is, how it works, to the benefits and risks associated with it, we'll cover it all. And don't worry, we'll explain it all in a simple, digestible way, no pun intended. So, buckle up for an engaging journey into the world of cutting-edge medical science. Stay tuned to learn more about this fascinating and important medical procedure. So, what exactly is a fecal matter transplant? A fecal matter transplant, or as it's known in the medical community, fecal microbiota transplantation, is a procedure that might initially make you cringe. But stay with me, as it's a fascinating topic that's gaining traction in the world of health and science. Let's start by talking about the trillions of microscopic organisms living in our gut, known as gut bacteria. These tiny beings play a crucial role in our overall health, influencing everything from our digestion to our immune system and even our mood. However, sometimes this delicate balance of bacteria can be disrupted, leading to a host of health problems. This is where fecal microbiota transplantation comes into play. The concept behind it is relatively straightforward. In this procedure, fecal matter or stool from a healthy donor is collected, processed, and then transplanted into the patient's gastrointestinal tract. The purpose? To replace the harmful or bad bacteria with beneficial or good bacteria. Think of it as a garden. If your garden is overrun by pests, you would introduce beneficial insects to combat these pests and restore balance. A fecal matter transplant works on a similar principle. It's about replenishing the gut with the good bacteria to help restore balance and improve health. Now, I know what you're thinking. The idea of transplanting someone else's fecal matter into your body might seem a bit unorthodox. But remember, this isn't just any stool we're talking about. The donor's stool goes through rigorous screening and processing to ensure it's safe and effective for transplantation. The fecal microbiota transplantation is a promising area of research. It's being explored as a potential treatment for a range of conditions, from gut disorders to mental health issues, and even obesity. So that's the basics of a fecal matter transplant. But how does it work? Well, that's a topic for our next scene. So stick around as we dive deeper into this fascinating world of gut health. You might be wondering, how does a fecal matter transplant work? Well, the process is more clinical and far less icky than you might imagine. The first step in a fecal matter transplant, or FMT, is selecting a suitable donor. This person must be healthy, with a well-functioning digestive system, and free from any infectious diseases or conditions that could be passed on through their stool. They're often close relatives or friends of the recipient, but anonymous donors can also be used. Once a donor has been chosen, their stool is collected and tested. This rigorous testing process is crucial to ensuring the safety and success of the transplant. The stool is screened for pathogens, harmful bacteria, parasites, and viruses to ensure it's safe for transplantation. After the stool has been thoroughly tested and deemed suitable, it's processed in a sterile environment. It's mixed with a saline solution to create a slurry, which is then strained to remove any large particles. What remains is a liquid filled with the beneficial bacteria and other microbes that will be transplanted into the recipient's gut. The actual transplant procedure can be done in several ways, but the most common is via a colonoscopy. The processed stool mixture is inserted into the colon, where the beneficial bacteria begin to colonize and restore balance to the gut microbiome. Other methods include enemas or even oral capsules, but these are less common. The whole process, from donor selection to the actual transplant, is overseen by a team of medical professionals. They monitor the recipient's health before, during, and after the procedure to ensure everything goes as planned and to address any potential complications promptly. So, while the idea of a fecal matter transplant might initially give you pause, remember that it's a carefully controlled and highly regulated medical procedure with the potential to provide significant health benefits. That's the process. But what are the benefits? Stay tuned as we delve into the fascinating world of gut health and explore the potential benefits of fecal matter transplants. Now let's talk about the benefits of fecal matter transplants. Fecal matter transplants, or FMT, may sound a bit off-putting, but this procedure holds some fascinating benefits. It has been shown to be extremely effective in treating certain diseases, most notably Clostridium difficile, an infection that can cause symptoms ranging from diarrhea to life-threatening inflammation of the colon. In fact, studies have shown that FMT can cure up to 90% of patients with recurrent C. difficile infection, a rate that far exceeds the success of standard antibiotic treatment. This is because FMT restores the balance of the gut microbiome, the community of microorganisms that live in our digestive tract, by repopulating it with healthy bacteria from a donor's stool. But the potential benefits of FMT don't stop with C. difficile. Ongoing research suggests that FMT could be a game changer in the treatment of other conditions linked to an imbalanced gut microbiome. These conditions include inflammatory bowel disease, irritable bowel syndrome, and even certain metabolic and neurological disorders. For instance, some studies indicate that FMT may help reduce symptoms and promote remission in patients with ulcerative colitis, a form of inflammatory bowel disease. This is a huge breakthrough considering the limited effectiveness of current treatments for this chronic condition. Furthermore, research is investigating the potential of FMT to treat conditions beyond the gut. There's early evidence suggesting that FMT could play a role in managing obesity, type 2 diabetes, and even neurological disorders like Parkinson's disease and autism. The idea is that by restoring a healthy gut microbiome, we can influence the body's overall health and disease processes, given the gut's wide-ranging impact on our body systems. However, it's important to note that while the potential of FMT is exciting, these are relatively early days in our understanding of the gut microbiome. More research is needed to fully comprehend the long-term effects and potential uses of FMT. While there are benefits, there are also risks involved. As with any medical procedure, fecal matter transplants come with their own set of risks. Although it's a promising field in medicine, fecal matter transplantation, like any other medical intervention, isn't without its potential pitfalls. Let's delve into some of these concerns. The primary risk is the potential for disease transmission. The donor stool used for the transplant is thoroughly screened for infectious agents, but no screening process is 100% foolproof. There's always a small chance that an undetected pathogen could slip through, leading to an infection in the recipient. Another concern revolves around the long-term effects of fecal matter transplants, which are still not fully understood. Remember, we're introducing a whole new community of microorganisms into a person's gut. While the immediate effects might be beneficial, we're still not sure what the long-term implications might be. For instance, could these new microbes influence a person's metabolism, immune response, or even their behavior? More research is needed in this area to fully understand the potential ripple effects of this procedure. It's also important to note that not all fecal transplants are successful. Sometimes the recipient's body might reject the new microbiota, leading to a recurrence of the original condition. Moreover, while rare, serious adverse events have been reported, these include serious infections and even death. However, these severe outcomes are incredibly rare and usually associated with severely ill patients or improper procedure. Despite these risks and uncertainties, it's essential to remember that fecal matter transplantation has proven to be a lifesaver for many people who've struggled with stubborn infections like Clostridium difficile, where other treatments have failed. Medical professionals and researchers are continually working to improve the safety and efficacy of this procedure, refining donor screening processes, and studying the long-term effects on recipients. Despite the risks, fecal matter transplants present a promising field in medicine. The potential to treat a range of conditions, from gut infections to autoimmune diseases, and maybe even obesity and mental health disorders, is too significant to ignore. As with any new medical frontier, it's all about weighing the potential benefits against the risks. Fecal matter transplants, while a little unconventional, are a fascinating field of study in medicine. We've delved into what they are, essentially a procedure to restore healthy bacteria in your gut by introducing fecal matter from a healthy donor. The process, although it might seem a bit out there, is quite straightforward and has shown notable benefits. From treating stubborn infections to potentially alleviating certain chronic conditions, it's clear to see why this area is gaining attention. But like all medical procedures, it's not without its risks and concerns. It's crucial to remember that while the benefits are promising, there are factors to consider, such as potential side effects and the need for thorough screening of donors. Knowledge is power, especially when it comes to our health. Understanding such procedures, as unconventional as they may be, helps us make informed decisions about our health and well-being. Remember to subscribe to the Health Collective for more health-related content. Thanks for watching and stay healthy.